We know that school is so important for children. In-person learning is important for their physical health and their mental health. So we really look forward to this upcoming school year and having children get the in-person learning that they need. Well, the Delta variant results in about twice as high a transmission rate compared to previous strains. So it's even more important to use the factors that protect against infection for children. And so if they're old enough to be vaccinated, that's the most important thing that you can do to protect your child. And then the second most important thing is masking. So have your child mask, and it's great if the schools have masking policies also. For children less than 2 years of age, it's not safe to wear a mask because we need children, if they have any difficulty breathing, to have the skills and recognition to be able to remove their mask if they need to so that they don't suffocate. I think the main things to look at is to look out for fever, you can look out for cough, runny nose, sore throat, loss of taste and smell, fatigue, even headache. It can start off with nonspecific symptoms. Those are the kind of things that if your child has that, don't send them to school. And we hope that schools have policies in place to screen kids so that if they are exhibiting those symptoms, then they're excluded from coming to school. When they're outdoors, it's best to mask if there's any kind of crowding, if people can't social distance. So, for example, for children, if they're in a contact sport, and they can safely mask, so something like football where if people are like blocking each other, they're very close to each other, and sometimes in basketball also, it's great if they can mask up during those situations. For other sports like tennis or maybe golf, where it's easy to social distance, for those it's not as important to mask. As long as we're having transmission of COVID and the virus is multiplying, that gives it an opportunity to evolve, to mutate, and to form more variants. So the more transmission that's occurring, the more opportunity for variants there are. And that's why it's so important to have as many people vaccinated as possible. And we know that the virus multiplies more in unvaccinated people, so there's even more opportunity for mutants to form when unvaccinated people get infected versus vaccinated people getting infected. So we really want to make sure that, in the U.S. that we have a high vaccination rate, but it just goes to show how important it is worldwide. We need to control infection. Otherwise, it's inevitable that variants will continue to evolve. Children are getting more COVID now than earlier in the pandemic, and that's because many children aren't vaccinated. Vaccines not available for children less than 12 years of age. Although it is milder in children compared to adults, children can have very serious disease, and it's important to prevent them from getting disease, to keep themselves healthy, and also to help prevent transmission to others.